Hello everyone. I want to show you a case I had recently on a patient who had prior liposuction of the abdomen and came in because she was dissatisfied with the overall result. And this is what I see not infrequently in women who really are better candidates for a tummy tuck procedure than for liposuction. And this is common as well in women who've had children. I think most women generally don't want to have a tummy tuck. First, the more extensive nature of a tummy tuck as compared to liposuction. And secondly, the recovery involved with a tummy tuck as compared to liposuction. And then thirdly, the longer lower abdominal scar that's required to facilitate a good tummy tuck procedure. And so the default position that most patients have is, how can I avoid the tummy tuck? And that's how sometimes they present. If I feel like someone needs a tummy tuck rather than liposuction, and I think that's true of this patient, she really was a candidate for a tummy tuck procedure, not for liposuction, then I really feel compelled to say that and to make sure that that patient understands that the results of liposuction are not going to be reasonably good or even aesthetically in any way appealing. And for this reason, I reject doing procedures in some patients because I feel like I can't get a good result, and I just don't want to do a surgical procedure where I'm not confident that I'm going to get a good result. The other issue with liposuction preceding tummy tuck surgery is that with liposuction there is going to be scar tissue present under the skin of the abdomen, and that scar tissue isn't always very easy to deal with and can limit my ability to perform the type of tummy tuck that I seek in my patients. So I prefer that patients come in without having had prior liposuction because I feel like I can give them a better result. Having said that, I certainly don't shy away from doing procedures on patients like this who have had prior procedures that didn't work out. This patient had liposuction of the abdomen. She presented, she had loose skin, as you can see here, marked contour irregularity. It just doesn't work out. It's not a good procedure in a woman who's has loose skin and or who has muscle wall separation. We went on to do a tummy tuck. I don't quite have those after photos, but we will come back to this in a few months, and I can show you this again. Another issue that I wanted to point out in patients is the need to address the pubic area during the tummy tuck procedure. The patient really should have a smooth, even contour from the abdomen to the pubic area where there is not a bulge either above or below the incision line. It should have a uniform overall thickness of the tissue both above and below the incision line for a tummy tuck. And again, this is something that we can review again at a later date. But I just want to let everyone know that that is something that I would be attentive to should a patient seek my expertise in performing a tummy tuck procedure.